Hey guys, Frank Cawley here again with Cawley Physical Therapy and Rehab, talking about another painful, irritable foot or ankle condition known as Achilles tendonitis. The Achilles tendon is made up of two muscles. That is the muscles up above here. One is known as the gastroc muscle, and the other one underneath that is known as the soleus muscle. Not necessarily that you know that, but what you do need to know is when they come down in the lower part of this leg region and insert into that heel bone here, that is the Achilles tendon. So what can happen with Achilles tendonitis is commonly, as you may have heard, tendonitis, so a tendon connects from muscle to bone and creates or aids in movement. So the Achilles tendon actually helps us to go up on our tippy toes and or lower us slowly down from our tippy toes. What can happen is in that tendon, you could develop micro tearing or trauma, or you could possibly get some inflammation in that tendon, and anything of that nature is known as Achilles tendonitis. So if you're suffering from this, sometimes the experiences of what you're going to feel or the pain or complaints that people tell us are, I have pain when I walk, especially when I push off on my toes. It's really hard for me to go up or sometimes down a hill. Steps are really difficult for me, especially when I try to lift myself up from one step to another. And when you take your hand and put pressure right in the backside of where the lower bone of your ankle, known as the calcaneus or heel bone, when you push on that area, it's very painful. Now, the little structure you see on top of the Achilles tendon area, looks like a stone, is a bursa. So a bursa is a fluid-filled sac that kind of aids in congruency to where the tendon attaches to the bone. It decreases frictional forces and helps, really helps out the tendon in many capacities. So if you ever hear of someone having bursitis, that's an inflammation of that tiny bursa right there, but can be very painful. And the way you distinguish from bursitis and tendonitis is generally, tendonitis is much worse with movement and activity, whereas bursitis kind of hurts all the time, even at rest. So some of the reasons you may suffer from Achilles tendonitis may include you're a runner, you walk a lot, you had trauma to that area, you're doing some sort of activity that involves up and down on your toes a lot, perhaps you're on the smaller side and whatever activity you're doing requires to be up and down on your tippy toes, and that creates pain and inflammation in that tendon, and therefore you then suffer from Achilles tendonitis. So people often ask us, well, what can you do for this? Well, I know a lot of times doctors, especially podiatrists and orthopedics, do not like injecting this area because it can leave it susceptible to tearing, especially if they get too many of them. So oftentimes, commonly, a first line of defense is physical therapy. So I highly encourage people to get consulted and get it checked out. Make sure that in fact they do have Achilles tendonitis and that it's not a tear or bursitis or some other problem that could be occurring in the foot that they were just assuming it was Achilles tendonitis. And by going to a good qualified physical therapist, they should be able to distinguish that, like the therapists here at Cawley Physical Therapy and Rehab. So if you're suffering from Achilles tendonitis, I encourage you to think PT first. Utilize your doctor as far as whether or not medication is indicated, but you want to use that in low doses because we know there's plenty of side effects and other issues with medication. And then, of course, injections or worst case scenario surgery should be a last ditch or last choice resort. I hope you found this video helpful and that it gives you a little bit of clarity if you think you're suffering from this problem. And if so, if you'd like to give us a call, feel free to contact us at any time or visit our website at cawleypt.net for any further helpful, useful information. And as always, I appreciate you listening and I hope you found it helpful. And we're going to switch gears here next on the video to follow. We're going to be going over some conditions that affect the shoulder. Thank you.